the third and the innermost and the most important layer of the eyeball, that is retina, the innermost layer here. Okay. Now this innermost layer you can see actually using artificial light and lens mechanism that is called as ophthalmoscope. Have you seen this in our college lab or anywhere? Ophthalmoscope. It is an instrument used to look through the pupil to the retina. Okay. That is an instrument that is called as ophthalmoscope. So inside this, it will look like this. This is our retina when we look through the ophthalmoscope. You can see this actually. Okay. So this is our retina, the posterior wall. If you go here, this part you are able to see clearly. So it will look like this. Okay. So things to identify here. The most important things you need to identify on the retina is the fovea centralis, macula, and optic disc. Okay. Okay. These are the three structures you should be able to identify. So let us go to this retina part here. On the medial side, when you are looking through ophthalmoscope, on the medial side towards the nose, you will find slightly less red structure. Okay. In general, whole retina will look reddish, pink, or even dark red also. In general, whole of retina. And you will see lot of blood vessels. Okay. But you will see that all the blood vessels are coming towards one point which is less red than normal. Okay. It is yellowish area. This is our optic disc. Okay. This is called as optic disc. So let me go back to the earlier slide here. This slide or any other slide here you can see. The optic disc is actually this part. This part is optic disc. Yani here it is a structure from which the nerves from the eye go out towards the brain, or arteries come in, or blood vessels go out. So this is the gateway of the eyeball. Optic disc is nothing but bulb al eye, or bulb of the eye, or whatever, a gate of the eye, door of the eye. Okay. So the nerve and vessel come in or go out through optic disc. So that is the importance. Second importance is because it is the gate, the nerves and blood vessels are coming in and going out. Because it is the gate, there are no receptors here. Are we clear? Do optic disc have receptors? Rods or cones?
No.
No receptors.
No.
Okay. So this area does not have receptor. So in the any object which you, when you are looking in the atmosphere, any object, if the image is falling on this optic disc, the person will not be able to see that. Therefore, it is called as blind spot. Okay. Therefore, it is called as blind spot. Our optic disc is called as blind spot. Please remember this. Are we clear till this part?
Yes.
So now you appreciate the importance of optic disc. It is an important place from where arteries and veins come in or go out of the eyeball. Second thing, the nerve also goes out towards its pathway through the optic disc. So whatever nerves are there here, coming from all the receptors, they will go out towards the brain through this gate. This is called as optic disc. Clinical importance, blind spot. Please remember this. Second clinical importance, whenever the pressure increases, it will compress the blood vessel and the nerve here. Whenever the pressure inside the eye increases, it will compress the blood vessels and nerve here. That will cause blindness. This is what happens in glaucoma. Pressure inside the eye is increased due to any reason. It will press the nerve and blood vessels here. Okay. Second thing to see in this retina picture, when you are looking through ophthalmoscope, second most important thing what you will see is, let me show you with the pen. On the lateral side, periphery side, on the lateral side of the optic disc, there is a region of retina where you will not see blood vessel. A region of retina where there are no blood vessel. Can you see this area? There are no blood vessel. This region has got more blood, receptors as compared to any part of the retina. Okay. So here you have lot of receptors here. As you go towards the periphery from this region, the number of receptor decreases. Are we clear till this point?
Yes.
So this whole area is called as macula. What is this area called as? Macula. Okay. Have you heard of a disease called as macular degeneration? This is a genetic disease in more common in Western countries. Macular degeneration. Okay. Now remember, the maximum receptors are here in the macula. There are more receptors here. Yani any light falling in this area, the person will be able to see better as compared to light falling anywhere else because there are less receptors in the periphery. As you go away, the number of receptor decreases. Okay. So macula is a region where there are more receptors as compared to any part of the retina. Third thing, right in the center of this macula, there is a point which is called as fovea centralis. Right in the center of the macula, there is a point called as fovea centralis. Have you heard this point earlier?
Yes.
Earlier slides?
Yes.
What was the function?
It was where the light is
Focused.
focused.
Exactly. So whatever the cornea and lens were doing, they were focusing light on one point. This point is nothing but fovea centralis. So it is in the macula. It is in the center of the macula. So the center of the macula you can see here is fovea centralis. Okay? Are we clear now?
Yes.
These are the things?
Yes, definitely.
Very good. These are the things you have to remember. Thing which you have to remember about macula and fovea centralis is, in general, there are more receptors in the macula as compared to any part of the retina. And fovea centralis is the point of maximum receptors. That too, only cones are there. Okay? Fovea centralis has got only cones. It does not have rods. So there are two types of receptor, rods and cones. Okay. So rods are more in the periphery, but cones are more in macula and they are maximum in fovea. Only cones are there in fovea. And here the sharpness of vision is maximum because there are maximum receptor. Therefore, in this region, we say we have maximum acuteness of vision, sharpness of vision. In proper term, it is highest visual acuity. For your exam, this term will be used. Highest visual acuity is in fovea, macula, optic disc, and something else. What is your answer?
Fovea.
Yes, please remember which of the following has got maximum or highest visual acuity. So option will have retina, fovea, macula, optic disc, anything. So the answer is fovea centralis. Please remember this. Okay, let us go ahead now. Just to complete this picture now, you see there are many arteries and veins which are seen here. Okay, arteries in generally are thin and veins are thick. Please remember this. This is how you as a doctor should be able to identify which are arteries and vein. Okay. So in general, arteries will be thin and veins will be thick. Because they are flat, they look thick. The arteries, they are not flat. They are filled with blood under pressure, isn't it? So they will look smaller and they will look shiny and veins will look darker. Are we clear till this point? This is how arteries and veins are identified, and this is the only place in the body where you are able to see arteries and veins directly without surgery, without cutting. Okay? So, this is a good place to know the condition of blood vessels in our body. So, this is a very important examination, ophthalmoscopy. Okay? These arteries and veins condition will be damaged in diabetes mellitus very commonly and also in hypertension. Okay? So, they are very commonly used this test to see the condition of blood vessels. Okay, ophthalmoscopy is very commonly used. Okay, now we come back to our physiology of the retina. We go into the depth. You can see here from the inside of the eye to the outside of the eye. Let me show you a better picture here. Okay, here it is better picture. We can see the outermost layer of the eye is here and the innermost layer of the eye is here. You can see here the sclera, then blood vessels, and then retina. These whole layers are retina. Then you have jelly-like thing. Then you have lens here. Okay, you can see here the lens here. Okay. So what happens is light travels through the lens and jelly. It comes through many layers, okay, of retina, and the outermost layer of retina is having receptors. So our light has to travel all these layers of retina to reach the receptors, rods and cones. Okay, clear? Any confusion here? Light must pass through several layers of retina before it reaches the receptors. So receptors are on the outer side and light is coming from inside like this. So it is obstructed by many solid layers of retina and then it reaches the receptor. Therefore, our eyes are not very perfectly engineered. They have this flaw. Okay? But Alhamdulillah, there is a place on retina where this flaw is removed. That place is fovea centralis. Okay? In this fovea centralis, what is done is, suppose this is the retina here, and these are the layers. In the fovea centralis, these layers are not there. So this point becomes fovea centralis. Here only cones are there. There are no upper layers. So light coming here will directly fall on the fovea centralis. For other part of the retina, the light has to cross all the 10 layers. Takriban 10 layers are there here. But on fovea, there are no layers, directly receptors are there. Are we clear?
Clear, doctor.
Good. Yes, doctor. Now we come to something which you need to remember for your exam. Number of layers in retina. So the outermost was rods and cones. They are called as our receptors. They are called as photoreceptors. Okay. These photoreceptors then synapse with bipolar cells, a type of neuron. They synapse with bipolar cells and bipolar cells synapse with ganglion cells. Okay. So we have receptors here. Then we have bipolar cell and then we have ganglion cell which are innermost in the retina. Okay. And these ganglion cell will give rise to axon which makes optic nerve. Okay. So we have ganglion cell here, we have bipolar cell here, and we have rods and cones here. Okay. Rods and cones here. So light comes from outside and will stimulate the receptor. Action potential generated will go to bipolar cell. Action potential generated will go to ganglion cell and that will be carried as optic pathway or optic nerve towards the brain. Am I clear till this part?
Yes.
Okay. Clear, doctor. So these are the three very important cells you have to remember. Okay. Now add two more cells. Horizontal cells are the cells which are between rods and cones and bipolar cells. Horizontal cells. So these are our horizontal cells. Similarly, amacrine cells are the cells between bipolar and ganglion cells. So they are amacrine cells like this. Okay. So they are there to increase or decrease the transmission from one cell to another. Horizontal cell will increase or decrease the transmission of action potential from receptors to the bipolar cell, and amacrine cell will increase or decrease transmission from bipolar cell to ganglion cell. Okay, they will increase or decrease. When they will do, we don't care. Just remember they are supportive function. Both horizontal cell and amacrine cell have got supportive functions. Okay, our horizontal cell will also connect different types of receptor. So whenever one is stimulated, the horizontal will inhibit the other two. How it helps in vision, we'll see later on. For now, remember horizontal cells can connect the receptors among themselves also, and they will connect receptor cells to the bipolar cell also. Okay. And what is the function of amacrine cells? They will connect bipolar cell into with the ganglion cells. Okay, for your exam, please remember the names of all 5 cells. Receptors, which is rods and cones, then we have bipolar cells, then we have ganglion cells. They are connected to each other, and ganglion cell will give rise to optic nerve. Okay. In between, supporting cells are horizontal cells and amacrine cell. Please remember that. I have repeated it many times now. Okay. So here is our receptor. Some description is given. In general, receptor cells have got two structure. One is the normal cell body with the nuclei, and then there is an extension of the cell body which is having layers. Multiple layers are there. They are called as disc. You can see multiple layers are there. Now this disc part may be rod shaped and it may be cone shaped, and therefore we have two types of receptor cells, rods and cones. So this disc structure may be cone shaped, therefore those receptor will be called as cone, and it may be rod shaped, it will be called as rod. Okay. This disc is to increase the surface area only. These many discs, folding of the cell membrane, here in cone shape, here in rod shape, folding of the cell membrane is increasing the surface area where a chemical is deposited. So more surface area yani more chemical will be there. What is that chemical called as? It is called as photopigment. Okay. Can you remember this? Our receptor has got a place on the cell where lot of chemical is deposited. That chemical responds to light, reacts to light. Therefore, it is called as photopigment. Okay. Now, this photopigment consists of two important things. One is a protein called as opsin. Another is a chemical which is derived from vitamin A called as retinal. Okay. Clear? So our receptor has got a chemical called as photopigment. It has got that photopigment is made up of two parts. One is opsin and one is vitamin A. Now you remember vitamin A deficiency causes night blindness. We have studied this in our schools, isn't it? So this is where the role comes in. So vitamin A derivative is stored in photopigment on these discs. So many discs are there in every receptors. Okay. Now some things I yes please.
This is found in both rods and cones, right?
Yes, both. The photopigment or chemical is present in both. What is the farak? In rods, the opsin in protein is of slightly different type, and in cones it is of different type. Okay?
Yes.
Retinal or vitamin A is present in both. But the protein is different in rod and protein is different in cone. Okay? What is the difference? Here comes the difference. Okay? Rod is very good for night vision. Okay? So when you are looking in night, your vision is using rod receptor. Cones, they are very good for day vision. So that means what? Are rods more sensitive or cones more sensitive to light? What is your understanding?
Rods more sensitive to light.
Yes, because they are able to see even in dark. Therefore, they are used in night, isn't it? So they are more sensitive. And cones are less sensitive. Are we clear? Now let us add to this information. Where are cones located? In the ophthalmoscope picture, I told you where cones are more. So where they are located?
Fovea.
Yes, 100% of fovea is cones, and majority of macula is cones. And as you go towards periphery, they decrease in number. In the periphery, in the very periphery, they may not be there, cones. So they are maximum in the fovea centralis, where maximum acuity is there. And this acuity is because of cones, sharpness of vision, because they are in fovea centralis. Okay? Clear? Rods are in periphery, so they don't have good acuity because light doesn't fall there clearly. Okay? So less acuity is there. Therefore, in the dark, we are not able to see things very clearly because acuity is for the rods is less. Okay. Third and next very important thing, the cone protein opsin. You remember this? The opsin in cones is of three types for three colors. So cones can see color vision. Okay. And rod can see black and white vision only. Therefore, in dark, you are not able to see colors clearly. You see shades of gray. So therefore, rods are for black and white vision, cones are for color vision. Can you remember all these differences? We are giving lot of time because this is what physiology's most important things are. Okay? So please remember them for your exam. Okay? Cones are highly low sensitivity. They are used for day vision. They have highest acuity and they are used for color vision. Okay? Please remember. Last point. Cones are less in number and rods are more in number. Cones are less in number. They are only in fovea centralis and surrounding macula. But rods are everywhere in the remaining eye. They are more in number. So roughly for every one cones, there are 20 rods. Okay. This was our last point of difference. Please remember majority of difference. Anyone can be asked whatever we have discussed. Now we come to how the function occur. I don't want to go into the mechanism of how things occur here. Please remember in general, whenever light falls, okay, whenever light falls on the receptors, it will cause chain reaction in the photopigments which are there. So what happens is whenever light falls, the retinal vitamin A derivative on the disc or receptors, it is in 11 cis retinal form, it is converted into all trans retinal form. That is all light does. Okay. When this change occur, it starts a chain reaction. Whenever all trans retinal is formed, it will cause activation of opsin, which will cause activation of transducin, it will cause activation of something else, then something else, then something else. Somehow it results in closure of a sodium channel. Okay. Now this sodium channel is working here, which was allowing sodium to go in, back in, and that will stop. Okay. And that will cause hyperpolarization. Okay. Now, if you remember, normally the receptors cause depolarization and not hyperpolarization. This is one of the rare example where the receptors respond by hyperpolarization. Okay. This is one of the rare example where the receptors respond by hyperpolarization. This sentence you have to remember for your exam. Rods and cone on stimulation by light responds by hyperpolarization. Number one. Number two sentence which you have to remember for your exam. The only light dependent step is when light falls on the photoreceptor, 11 cis retinal is converted into all trans retinal. Okay? The only light dependent step. After that, automatic reaction will occur. So this is your second sentence which you have to remember for your exam. Rest things you just need to understand. You don't need to remember. Okay? Now, when this hyperpolarization occur, there is change in the neurotransmitter secreted by the receptors. Okay. So I don't know where to show you that receptor. Okay. Here. So whenever hyperpolarization occur, this the receptor cell is synapsing with bipolar cell, and bipolar cell is synapsing with our ganglion cell, and that will carry action potential. So whenever hyperpolarization occur, it will cause decrease in the neurotransmitter here. That will change the number of action potential which are going towards ganglion cell. Okay. So in some receptors it will change, in some it will increase, and in some it will decrease, depending upon the horizontal cells which are present here. So don't go into the confusion here. Just remember the receptors will cause hyperpolarization that will change the action potential going towards ganglion cell. What change occurs? Don't worry about that. Okay. Okay. So now we come to another thing called as on center and off center. Okay. So imagine on the retina. So this is our retina here. So there is a receptor here, and there is a receptor here, and there are receptor here. So light from the lens is falling here like this. Okay. Light is falling on the receptor like this. So this receptor is activated, and that will cause hyperpolarization, that will cause bipolar cell to become on center. Yani it will be activated. Hyperpolarization causing activation. Okay. So whenever this occurs because of horizontal cells, it will inhibit the surrounding cells. So these surrounding cells will be inhibited. This is called as lateral inhibition. So these two bipolar cells will be inhibited. These two bipolar cell will be inhibited because the receptors are inhibited. Okay. And they are called as off center. So whenever light falls on one receptor, the chain bipolar and ganglion cell becomes on center. The surrounding will be inhibited. They are called as off center. Okay. So off center bipolar cell, off center ganglion cells. Okay. So what is happening is whenever one receptor is stimulated, it will carry action potential and the surrounding will be suppressed. So surrounding receptors, surrounding bipolar cells, surrounding ganglion cells will be suppressed. Okay. So this is how when one pathway is carrying action potential to the brain, the others are suppressed. That is how you create comparison with the surrounding in atmosphere. Okay. Now, whether you understand this or not, this all what I have discussed, whole slide, whether you understand it or not, for your exam, the only thing which you have to remember is the in the retina during processing, some cells become bipolar cells become on center and some become off center. Similarly, some ganglion cell become on center and some become off center. This all is done by the supporting cells, that is horizontal and amacrine cell. This mechanism is used to increase the sharpness of vision, brightness of vision, creating contrast. This is the purpose of all this activity. Again, I repeat, for your exam, remember bipolar cells can become on center or off center. Ganglion cell can become on center and off center. Okay. This is all you have to remember. Now I'll show you the real life effect of this mechanism on center, off center. You can skip these two slides if you don't have time. If you have time, you can read. Okay. This is how we use this on center and off center function of bipolar and ganglion cell by identifying the margin of any object. You can see the margins of this thing, isn't it? This triangle you are able to identify because you are identifying the margins. How you identify the borders or margin? You compare with the surrounding. Okay. If the surrounding is not there, if you surrounding makes you make the surrounding same as that of the object, you'll not be able to compare, isn't it? You'll not see the margin, isn't it? So to identify the margin, use this. Okay. Now you can see the effect of this comparison. The borders, all these cells are on center. You are making on center. The surrounding are inhibited. Okay. Now, if you use this in real life, what happens? Please have a look at the slide here. The rod, which you see, it is moving. You will see that it looks like as if it is changing color. You can see here it becomes white here, and when it goes up, it looks as if it is becoming black, isn't it? Darker and lighter shade occurs in this rod. Why this is occurring is because our eyes are using on center effect and off center effect, and here the background is becoming dark and here the background is becoming light. The rod is not changing color, only the background change is occurring. You can see here background here is dark, therefore rod looks light, and here the background is light, therefore the rod looks dark. The color of the rod is not changing actually. Are we clear? This is the effect of on center and off center cells in retina. So what they are doing is just enhancing the contrast. Here the rod is darker as compared to the background, so that is enhanced. So darkness is enhanced. Here the same rod is lighter as compared to the background. That lightness is enhanced here. Therefore the rod looks white here. Are we clear till this part?
Yes.
Clear, doctor.
Okay, just remember this is the amazing thing which retina does. The color of the rod is not changing. Even this color of the moon is not different. This shape, curve. Here it looks dark, here it looks white, isn't it? Because this part is coming in the darker area. You can see the triangle here, you can see the triangle here, you can see the triangle here. You have some triangle somewhere here also. Okay. All these triangles are of same color. You can see the triangle when it goes towards the darker area, it looks white. Same triangle. Okay. And when it comes to white area, it looks black. So this is the contrast effect created by on center and off center. And this results in many illusions you see on WhatsApp and Instagram. This is one of them I have copied from Instagram. You can see the dark point here. Suppose you are focusing on this point. So this dark dot, you are focusing on your fovea centralis, that is causing the other one to be suppressed. Therefore, you are not able to see dark spot other places. When you focus there, you see the dark spot here, isn't it? Otherwise, you are not able to see. Therefore, based on your focus, some area is becoming on center, some area is becoming off center, and that is how these dark spots are vanishing. So in total, how many dark spots are there in this picture?
Doctor,
Yes,
is
please.
it one or multiple?
Whenever you are focusing, it is on. This dark one is on. If you are focusing on this dark one, okay,
Yes, it
the
is like,
surrounding become off. The brain is suppressing the surrounding information. Therefore, you are not able to see the dark spots at other places. Clear?
Okay. Is it
Okay.
like?
So this is how this illusion works. I'll show you more illusion, I think. No, we have removed the other slides.
Doctor, is it like
Yes.
video because it's moving?
Nothing is moving. Nothing in this picture is moving. Please check. Nothing in this picture is moving. You feel the black spot is moving because you are changing the focus of your eye.
Okay.
Nothing is moving in this picture. You can count the number of dark spots. There is a dark spot here, there is a dark spot here, there is a dark spot here, and there is a dark spot here. Similarly, you have a dark spot here and you have a dark spot here. Yani in total, I can see 12 dark spots are there, but anytime I see only one, the other vanish. Isn't it? The one I can see is because it is stimulating my on center. That pathway is becoming on center. The other are suppressed.
Okay. So you see one at a time.
Yes, this is the job of retina to make select one information, send it to brain, and suppress the other information. Okay, therefore you are not able to see all the 12 simultaneously.
Subhanallah, amazing.
Alhamdulillah, Alhamdulillah. This is one of the very, this is what more than brain, the retina is itself deciding what brain should see. Okay, based on where you are focusing. Every time you change your focus, now if you focus this dark spot, the other dark spots vanish. If you focus here, you see this dark spot, but the other vanished. This is how processing in retina occurs. Okay. So this was the thing. This processing occurs because of the horizontal cell and migraine cell. They primarily are causing surrounding inhibition, inhibiting the surrounding cell. This is called as lateral inhibition. Okay. Let us go ahead. We have some less time left, so we'll not go into more discussion there. Okay. So whatever processing has occurred, the ganglion cell will give rise to axons which will make the optic nerve. So for your exam, there are 5 cells in retina. Which of them gives rise to optic nerve? Which cells give rise to optic nerve?
The axons of ganglion cells.
Ganglion cell gives rise to optic nerve. The axons make optic nerve. Or axons of ganglion cell make optic nerve. So let us see the pathway. So here is our retina, ganglion cell giving rise to optic nerve. Optic nerve coming out from each eye will come out like this. The part of the retina on the nose side and part of the retina on the temporal side have got different pathway. Okay. Part of the nerve fibers coming out of the eye from the nasal side cross to opposite side. Part of the nasal fibers remaining on the temporal side will not cross. They will remain on the ipsilateral side. You know this pathway. You might have covered this in anatomy. Am I right or wrong?
Yes,
That's
doctor.
right, Doctor. We took it in your-
Good. You have covered this in anatomy, so I will not go into too much of discussion. Just I'll tell you the names: optic nerve, optic chiasma, optic tract, and optic radiation. Are we clear? After the thalamus, this is called as optic radiation. It is in the cortex. It goes to the visual cortex finally. Are we clear? Okay. For your exam, you have to remember these are the branches which are given. The branches of the optic pathway go to brainstem. In midbrain, they are given to superior colliculus and pretectal nucleus. And they are also given to hypothalamus, suprachiasmatic nucleus. So our suprachiasmatic nucleus, if you remember in hypothalamus lecture, is also called as biological clock. Okay. So our clock needs to know whether it is daytime or nighttime. So it receives information from the eye. This superior colliculus and pretectal nuclei are the centers for reflexes. So whatever reflexes we have studied, the light reflex, accommodation reflex, and many other painful reflexes are there, or pain-related reflexes are there, or vision-related reflexes are there. The center is in superior colliculus and pretectal nuclei. Okay. Now we come to the thalamus. All the pathway have to go through thalamus and then they go to cortex, isn't it? So in the thalamus, the visual pathway go to lateral geniculate body. Lateral geniculate body in the thalamus. Okay. For your exam, please remember this. Whenever there is damage to optic nerve, it will cause complete blindness in one eye. That is called as unilateral blindness. Whenever optic chiasma is damaged, it will cause loss of fibers which were crossing. Okay, so we have crossing fibers like this and crossing fibers like this. Okay, and their vision was from the temporal side. Their vision was from the temporal side of both the eye. Therefore, by temporal half blindness. Hemianopia याने anopia याने blindness. By temporal half blindness. For your exam, whether you understand it or not, optic chiasma lesion will cause bitemporal hemianopia. This occurs usually when there is tumor in the pituitary gland. So pituitary gland is somewhere here and it is compressing the optic chiasma. So if there is any tumor in the pituitary gland, usually bitemporal hemianopia can occur. Okay. Now we have homonymous hemianopia. Yani same side of henia. What will happen when there is damage to the optic tract? So half fibers of one eye and cross fibers of another eye, both are cut, isn't it? So both are fibers like this. They were carrying information from one side, isn't it? So either in the left eye, right side vision is lost of both the eyes, and in the right eye, left side vision of the both the eyes is lost. Okay, so side remains common, homonymous, half blindness. Okay, this will occur in the optic radiation also because it is the same which is containing, except the radiation, the fibers are spread a lot. Okay, so it is very difficult to cut all the fibers. So usually some fibers remain. Because there are more fibers coming from macula, they will remain. Even if some are cut, some which remains are usually from the macula. So homonymous hemianopia with central vision, macular vision is called as is due to optic radiation damage. Are we clear till this part?
Yes.
Yes.
Okay, because this is again always asked in anatomy also. Sorry, please repeat.
C is due to optic tract damage.
Let me repeat this. Let me repeat everything for your exam. Okay. I'll tell you the proper word which are asked in exams. Okay. What will be the effect of damage to optic nerve? It will be unilateral blindness. What will be the effect of damage to optic chiasma?
Bitemporal.
Very good. Bitemporal hemianopia. What will be the effect of damage to optic tract?
Homonymous.
Very good. Homonymous hemianopia. What will be the effect of damage to optic radiation?
Homonymous hemianopia with macular.
Exactly. This is how the question and answer should be. Okay? This is how the questions will be there. This is how the answer should be there. Now again remember, there will be lot of history in the question. So don't confuse yourself. Just focus on what it is telling you. Is it unilateral blindness or it is the blindness of half eye in temporal side in both the eye? So that is bitemporal. Or it is half blindness in one side, either right side or left side. So that will be homonymous. Or there is macular sparing. Something will be given in the history for signal. Again, I'll see to it that it will not confuse you. Very straightforward things are asked. Okay. So remember these terminologies. Okay. Now, once the eye tract, the optic pathway reaches the thalamus, it goes to lateral geniculate body or lateral geniculate nucleus. It has got number of layers. Here it is shown 6 layers are there. In these 6 layers, there are 2 major types of cells. Parvocell यानी small cells and magnocell यानी large cell. For your exam, don't remember all these details. The only thing you have to remember is the function. Magno cell यानी large cell यानी they are fast. They are used for carrying information related to movement, depth, flicker or sudden change. Okay? Any sudden change in the visual atmosphere that is detected by magnocellular pathway. The details of the vision are carried by parvocellular pathway. What is the color of the object, what is the texture, shape, and other fine details. They are carried by parvocellular pathway. This is very important for our exam again. Magnocellular pathway function and parvocellular pathway function. Please remember them. Okay? Let us go ahead. Visual cortex. What is the location of visual cortex?
17.
Most central.
No.
Occipital.
Occipital lobe. Postcentral gyrus is in parietal lobe for general sensation.
Yes.
For visual sensation, it is in the occipital lobe. The sulci, which is famous, is calcarine sulcus. This is the calcarine sulcus. Okay, it is also called as calcarine fissure. Okay. So surrounding that, whatever gyrus is there, that is the gyrus which is having primary visual cortex. Outside this primary visual cortex, you have secondary visual cortex. Outside this secondary visual cortex, you have a very large association visual cortex, which is extending into parietal lobe also. Are we clear?
Yes, clear.
So we have a
Clear.
primary visual cortex surrounding the calcarine sulcus. Surrounding the primary visual cortex, we have secondary visual cortex. Surrounding the secondary visual cortex, we have association cortex, which is very large. It is extending into parietal lobe also. It is extending into temporal lobe also. Visual association cortex. Okay. Are we clear till this part? There are
Yes.
some things which are confusing from the next few slides. Therefore, I am asking you repeatedly. Are we clear till this part? Three cortices
Yes, sir.
are there. Primary,
Yes, sir.
secondary and association cortex. Okay. Now remember this. Unfortunately, this requires actually blackboard, but we don't have. So just remember this. In the cortex, there are 6 layers. Okay. So our optic pathway, whenever it comes here, it will send the information to all the 6 layers. Few thousand neurons from all the 6 layers will process action potential coming from one nerve from the visual pathway. So for every one nerve which comes in, there is a few thousand neurons connected with it from all the 6 layers of the cortex. So they are making a column-like structure in the cortex for every nerve. So whenever action potential comes here, all these neurons in the 6 layers are activated. Okay. So they will process the information. So some neurons will process information for the borders, some will process for the shape, some will process information for the texture, some will process information for color, and they are the columns. Okay. For the color, they are called as color blobs. Okay. Clear? Any confusion here?
Clear.
Okay. Now let's make it a bit complicated here. So what is happening here is, suppose this is the cortex here, first few 6 layers of the cortex, primary visual cortex, okay? So action potential is coming from the eye into the cortex. So it will activate certain circuit. If the object was red color, it will activate the red column. It will, if the object was round, it will activate some other column. If the round was soft texture, it will activate other column, isn't it? Our secondary visual cortex is observing that, okay, so this circuit is activated, this circuit is activated, and this circuit is activated. So it will cause activation of certain circuits in the secondary visual cortex. That will say that the object which is bringing this information, which has activated certain circuit, is red colored, round, and smooth textured. Okay. So in the association cortex, there is another layer which is observing which circuits are activated here in the secondary visual cortex. Okay, it sees this circuit is activated, yane the object is red, round, and smooth. It sees that another circuit is activated. This says some other information. So it will compare this area. The association cortex will compare this stimulation occurred last time because we had a red cricket ball or soft ball. Yani, right now the person is seeing red soft ball. Okay, clear? This is how we are able to see. So this is our simple cells, this is our complex cells, and this is our hyper complex cells. This is how we identify object. Okay. Whether you understand it or not, it's just for understanding. If you want more detail, we can see later on. Now we come to the last part. The last part will require 10 minutes of discussion. Do you want me to take break? Or do you want break?
Yes,
Or
doctor.
shall I continue?
Yes,
Yes,
break.
doctor, please.
Yes for break or yes for continuation?
Yes, for
For
break.
break.
Okay. So what is the time right now?
It's 3:57.
3:57. Again, we'll start at 4:05 and inshallah we'll finish in 10 minutes maximum because the remaining 2 or 3 the concepts does not require explanation, just the thing which you need to remember for your exam. Okay. So our lecture remaining is 10 to 15 minutes. Please take break. Come back at 4.